Brought to you by GTA, your island, your network. He says he simply wants answers.
If it seems like the legislature, the media, the public are attacking you, we're not. We're demanding the truth from the few political appointees at the top.
What is the truth behind GMH? In a message addressed to employees and volunteers, Senator Dennis Rodriguez Jr. says he's launching a full-on investigation against the Guam Memorial Hospital management. This comes after GMH announced last month they're losing accreditation, but withheld publicizing the findings of the Joint Commission report. That's until senators made it public. In the most recent video posted by the administration, GMH staff nurse Mark Waco says,
The Joint Commission report is not meant to go out on public. If the intention was really to made it out on public, it should have been discussed with a medical or health professional. That we are understaffed, we need money. And I think that's what the report is trying to tell us.
It's the same narrative of underfunding that GMH staff, doctors, nurses, and administration have sworn by. Senator Rodriguez agrees in part, saying, quote, "It doesn't take too much to see you need new facilities and new equipment," end quote. But one of the reasons he's investigating is to find if employees were pressured by the top.
One of the reasons I'm asking senators to convene an investigation into the hospital management is that some of you have told me that you have been pressured to be part of the controversy. No one should be pressured to do anything. You don't need the politics. You don't need the smoke and mirrors. You don't need the pressure coming from the top, the corruption, the cover-ups, the dishonesty or the threats. You are professionals, and professionals don't behave this way.
The $90 million question: what's in the report? Some of a lengthy list of citations include broken fire alarms, smoke and heat detectors, stained ceiling tiles, expired medical devices, blood tubes, and defibrillator pads, and breast milk not properly chilled. The report including physicians, staff, and pharmacists who didn't attend mandatory education training. On GMH's list of priority, Vice Speaker Therese Terlahi in a work session Thursday points to $150,000 needed to demolish the old MRI building in the parking lot.
I'm not a doctor, but I can't see how a building sitting out beyond the parking lot is affecting any patients at this point, and why that is going to be prioritized over paying your vendors, over getting your equipment for patient care.
Other citations include that the board hasn't met since July 2017, to which CEO Peter John Camacho clarifies they met quorum in December, but the meeting notes were not ready in time for the Joint Commission. Meantime, Rodriguez will continue talks with GMH. Hospital officials are scheduled to go before lawmakers again at a later date. Reporting for Guam's Network, I'm Carmen Victoria Terlahi. Brought to you by GTA, your island, your network.